This morning, the Supreme Court ruling dropped moments before I walked into my first operating room to provide abortion care here in California, where the right to reproductive freedom is protected. I'm feeling very grateful to be in the state that I'm in, but completely devastated for the communities across the United States.
The South is my home. It's where I was born and raised, where I've lived for most of my life. And I am terrified for people in my community who will likely no longer be able to access the care that they need in our state.
My heart goes out to all of the patients who will be directly impacted by today's ruling, especially patients that are already marginalized in our healthcare system. Black patients, Latinx patients, LGBTQ+ patients, Indigenous patients, low socioeconomic patients. I could go on. I really could go on.
This ruling is causing me to think about all the patients who I saw this week who told me that they had to wait until payday to access their abortion and who now don't have access. Yeah.
At this time, I'm angry. I'm angry that the rights and the autonomy for my patients have been stripped away from them. But I'm also driven. I'm driven to keep showing up for my patients and to keep providing this care and to keep fighting, because this is our basic human right, healthcare.
And I'm specifically thinking about a patient sitting on labor and delivery right now at 20 weeks along in her pregnancy with a very highly desired pregnancy, who is finding out information about how poor the prognosis for her pregnancy is right now. And luckily, because we're in Oregon, I'll be able to take care of her no matter what her decision is and support her every step of the way. And yeah, feeling really lucky to be in Oregon and feeling really sad for the people and my colleagues who are elsewhere in the country who are going to start seeing the effects of this immediately.
Staff have come into the clinic and one of my staff said, "Oh my God, I need to get my tubes tied because I don't know when our laws are going to change in North Carolina, and even though I have good birth control, I just can't be pregnant, and I'm afraid." I heard another staff member say, "Oh my God, I really need to make sure I take my birth control." I think there's just this heaviness here.
We are anticipating that more patients will be traveling to Pennsylvania now that the SCOTUS decision is finalized. The staff, the compassionate nurses and assistants, and administrative folks that I work with, everyone's heartbroken today. Everybody's outraged today, but we'll keep fighting.
You know, I am lucky enough to be in a state where abortion access is protected. And I know that means that the reality of abortion isn't going to change hugely for my patients, but it does mean that I'm going to be seeing patients from other states. Every single state that borders Illinois is poised to already restrict or severely limit access to abortion. And that means those patients are going to be coming to seek care with us here in Illinois.
It's difficult to know that this is where we are in this country in 2022, where over 50 years of precedent seems meaningless, although we know it's not.
This is a devastating ruling for half of the nation, and it highlights the inequities in our government and in healthcare. But we will remain steadfast in our commitment to take care of people and their bodies in their time of need.